Heidi, let's begin with you. Tell us about that journey from anthropologist to vaccination expert and advocate. How did you get from there to here?
Well, I had initially wanted to become a medical doctor and actually a biomedical engineer, which is kind of a bit pretty far from anthropology in some ways, but not in all. And I ended up realizing that I was much more interested in kind of the human factors that affect health. And I've pretty much dedicated my anthropological work to health. Introducing new vaccines is quite different, as we see now with COVID, than routine vaccinations. And I saw that we were losing the confidence of the public in some small ways and in some big ways. And I didn't see that trend getting any better, which is why I founded the Vaccine Confidence Project.
How does it operate, and what are you seeking to do?
The Vaccine Confidence Project is based at the London School of Hygiene and Tropical Medicine, but we have collaborating partners, research institutes. How we work, it's a very diverse team. We have myself and another anthropologist, psychologist, epidemiologist, big modelers, because we use a lot of data and we have to analyze it. It's a bit of detective work in a sense. We look at the landscape, we see when new things emerge, we try to understand where they're coming from, where they're going, who's believing them, and try to understand why, because if we don't address the why, you can clip it off, clip the heads off the weeds, but if you don't get into understanding what's driving it, it's going to be a very limited success.
How vaccine rumors start and why they don't go away. How do they start and why don't they go away?
Well, they usually start when people are trying to make sense of things that don't make sense, which is why I think COVID has birthed an innumerable number of rumors. And it makes sense in a way, because you have human natures to try to make sense of things and try to simplify it and have it have meaning to them. And when that's not there, they try to put things together. I should say, try to make sense of things, make connections. And when you're in a situation like COVID, where even the science is evolving and not complete, it's really a field day for rumormongers, and I think for just common people who, it's pretty tough. It's pretty uncertain time. Why they don't go away? I find that rumors, there's huge variation in rumors, but there's also a lot of themes that keep persisting, and they kind of wait for an opportunity. Anxieties about sterilization and population, anxieties about being controlled, perceptions of them, and anxieties about the motives of other people. These are all kind of deep anxieties in people and communities, particularly if you're marginalized. And when you see things happening in ways that are you don't understand, it kind of begs you to you need to blame something or give a reason for something. And that's what's made the current environment particularly complex. I wanted to give a talk called Put Your Guns Down, People Are Scared. It's, we tend to think if people don't sign up for vaccines, they're, quote, anti-vax. And that's really not what's going on in a number of cases. There are the extremists, but there's a lot of other things going on.
Let's say I'm running a very large U.S. company, maybe a global U.S. company, and I'd like to have more impact on the behavior of the people who work for me in a positive way. Is this the kind of campaign or messaging that they or their teams could pick up from your organization and then push out into their system? Because, for example, I was speaking just the other day with a CEO of a very large company who said, well, he's fed up with this resistance and refusal to or denial, and he's going to require that everybody get vaccinated in the company. And I said to him, well, you may find that some of your younger employees will simply walk. There's lots of jobs out there at the moment. And if they're 25 to 35, they can go computer program somewhere else. And maybe you should take different tack, perhaps like the one, Heidi, that you've described.
I think the starting point shouldn't be about vaccination.
Yeah.
I think if I were, and this is the advice I've
Yes.
been giving to a number of companies, is I would start with hearing out, saying, "Listen, we have to think through how we get back to whatever normal will be in our company. I want to hear how all of you are doing. How are you coping? What are the things you need most?" And then by starting to say, we're keen to help you get back on your feet, get back to work, make the work environment a safe one. And in the mix of those things, bring in vaccines. But I wouldn't start from okay, you have to take a vaccine to come back to work. Unless, of course, you're talking about a healthcare setting, which is a different story.